Hi, this is Dr. Walker from dinnerwalker.com. Welcome back to the channel. Welcome back. We had a great weekend. Talk a little today about autoimmune disorders. There was this kind of a sad story I heard today and prompted me to sort of talk about this just really quickly. So I saw a patient today. Well, I saw the request for the patient today. And the issue was that she has an autoimmune disorder. Autoimmune disorders are essentially where your body begins to attack itself from what it sees as the offending issue or concern. So she had her thyroid gland removed because she had an autoimmune disorder, and doctors could not see any other option except to remove the thyroid. And I promise you, 8 years ago, I would have probably done the same thing, because when it comes to what I'm going to talk about, which is really lectins and leaky gut syndrome, lectins is LECTINS, there isn't much as taught in school about this, and so we do what we know that is easiest and best to do. And sometimes that includes removing a organ or organ system that really is not at fault for anything that's happening. So this really is about anyone that has an autoimmune disorder, and my thought on what should happen before someone goes in and take out an organ that once you take out, you can't really put it back in. And so that is the reason I'm having this discussion, because in my view, it was a very sad thing to happen. So anyway, autoimmune disorders, as I said before, are a process by which your system begins to attack itself. And many times, there is an association between what you've eaten and the autoimmune disorders or complications of the disorder that you're having. So there's a thing called leaky gut syndrome. Leaky gut syndrome really is that you've eaten some food, and these foods tend to cause little holes in the gut, which then those particles that leave the stomach, and again, outside the stomach, there should be nothing except just your body fluids and that sort of stuff. But they get outside of the confines of the stomach or the bowel, and they get into the abdominal cavity. Once in the abdominal cavity, the body sees it as a foreign entity and begins to attack it and kills it. That's essentially the antigen that needs to then have an antibody to say, this is a foreign entity, I need to destroy this thing. And so it does. And the body does that in a really good way. It goes in and finds the things that is causing it to be suspicious, and it essentially creates a process by which it gets rid of those things. Unfortunately, when that happens, and again, that's part's called mimicry. When it happens, you can create an antibody, and the antibody can look like cells in the thyroid, in your eyes, in your adrenal glands, in your kidneys, right? It can look like a cell in any of those things, and each of those cells have receptors on them. For example, the thyroid has receptors on the thyroid, and yes, you could get one of these antibodies fit nicely with those receptors on the thyroid, and it helps the thyroid to create even more hormone, like in Graves' disease. So it creates more hormones than the body can use or should use at that time. So you get an autoimmune disorder called Graves' disease. So what some doctors will do is they'll do tests and series of tests and so forth and try to find ways to sort of decrease the hormonal levels from the thyroid. And at some point, it's just too much, they can't handle it. But there's almost never ever, there's almost never a discussion about what are the causes or the potential causes for these autoimmune disorders to occur. Again, what we do is what we do best. We can't find the solution to our question, i.e. how do I get this thing to normalize itself? So then we take it out. In this case, she got her thyroid gland taken out, and then she'll be on medication for the rest of her life. Now, unfortunately, and the reason I have contention with all this is because I know that, yes, this is 2025, but we are not beginning to understand the complete functions of anything, right? We do not understand the consequences, the long-term or short-term consequences of things like removing the thyroid. Now, yes, we know a lot. in this sense, in this date, and this time that we know a lot about, back up, what we think is a lot about an organ system. We said in the past, like for example, we said the appendix had no reason to be in the body, yet God made it that way. It's in the body. I promise you there's going to be a reason for it being in the body. That's my personal take on things. Thyroid, again, we see what it does for the most part, and we understand a little bit what it does, but we do not yet understand the full implication of what all the thyroid does. But what we're going to do is take it out, and then we're going to give you a pill that says you'll be on this pill for the rest of your life. Why? Because we could not control the thyroid function in and of itself, or what's causing it to be essentially overacting. And I would suggest this to anybody that have an autoimmune disorder, that before you get to the point of someone removing your organ system, give it full thought. Look at the foods you're eating, and there are a list of things, and it's been talked about by a lot of folks, but again, not in the medical professional community for too long. Look at the foods that you're eating, and there are foods that you're eating that has a protein called lectins. Lectins, again, are the things that cause the leaky gut syndrome and causes essentially this antibody to be created. So you can look at that list, and many people would agree that some of those things, and it's like a protein that plants and other things use as defense for people not eating them as frequently, as quickly as they do. But look at some of those things. Things like the nightshade things, like eggplants, sometimes even things like cashews and peanuts and tomatoes. The seeds and the skin of tomatoes can give you some problems. But again, there's a whole list of those things. Peppers, for example, bell peppers, green peppers can cause some of those things. But look at the list of things, and I'll put a link in this video regarding the list of foods that are, quote, high in lectins. But you have to really at least give it a chance. Remove those things. Some people actually say go straight to a carnivore diet or go to a keto diet just to be able to remove some of those things that are high in lectins, and see what happens. And give it due process. Give it 3 or 4 months and see what happens when you've changed your diet to remove essentially all high lectin containing foods, and see what happens. Now, it doesn't mean that your problem is going to be resolved, but maybe it becomes manageable at that point, because I don't know that you can actually remove all lectins. And for each of us, the thing that causes my body to be upset at me, pissed off at me, may not be the same thing for you. For me, it may be cashews and peanuts. For you, it may be tomatoes and vice versa. But you have to watch what you're eating and kind of remove as much as you can regarding lectin products, containing products, and see what essentially happens. And again, once you take your thyroid out, you can't put it back in, right? Then you're on medication for the rest of your life, which seems to be the drug du jour for many of us now, to give you a pill that you're on for the rest of your life, as opposed to having a discussion about, hey, let us consider these things which are known to cause cell mimicry and see what happens short-term, long-term. And again, it may not solve your issue, but you deserve to give yourself a chance to help yourself and find the source of your ailment. And again, when you have one autoimmune disorder, the conversation is and has been that you probably have more than one. So even this lady who has her thyroid taken out, it doesn't mean that those antibodies or the antigens or the foods that cause you to have a problem, it doesn't mean that they stop being a problem in your system because your thyroid is now out. It simply means that it's just not attacking your thyroid anymore because you have no thyroid. But it doesn't mean it's not attacking something else in your system, causing you more inflammation. And as we all know, inflammation is a harbinger of disease. Thanks for listening. Dr. Walker, take care.